You have that phrase, a red flag? It means a warning, something to notice. Because what's likely happening here is that she had a very mild elevation of TSH that was related to her stress. And so when we put her on the wrong treatment for her stress, which was to treat her thyroid, she didn't get any better. In fact, she may have even gotten worse. She has a family history of anxiety, depression, and dementia. And a maternal grandmother had dementia the last 10 years of her life. Her brother had depression for 3 years. She had an uncle who was manic depressive and committed suicide. So this is a family who may have some genetic differences in how they manage brain chemistry. So here is a family that already has some differences in their brain chemistry, and what are we doing? We're just putting one drug after another that we don't know what it's going to do. Well, let's try this one. Well, that didn't work. Well, let's try this one. Well, that didn't work. Well, let's go back to that one. What are we doing in a patient that already has a family uniqueness about their brain chemistry? So what about her diet? Well, you know, she's from America, so she's got the American diet. High carbohydrate, high glycemic load, doesn't eat fish, eats a lot of meat, lots of fat, carbohydrates, some fruits and vegetables. Now, this is kind of interesting. In America, if people say you should eat 5 servings of fruits and vegetables and you're a midlife woman, what are you going to eat? Fruit. You're going to eat the fruit. You're going to go for the sugar, right? So I tell women fruit is a different category than vegetables. Fruit is a substitute for sugar, like chocolate, cake, candy, okay? And vegetables is what you need. So fruit is a rescue from your craving for sugar. Vegetables is a different category. And she has 2 or 3 caffeinated beverages a day, so caffeine increases adrenaline. What does adrenaline do to the stress hormones? Adrenaline automatically raises cortisol. So she is raising her cortisol every time she has that caffeine. And she has no known food allergies or sensitivities. Oh, no, I don't have any food sensitivities. Okay. There are not a lot of people who get to 50 without some food sensitivity. They may, if they have a very healthy GI tract, they may tolerate it pretty well, but I'm betting there's some food sensitivities. So she does a 24-hour food recall, and I have all my patients do a 3-day food recall. They write it out before they come in because I want to get a sense of how many meals they're skipping. She skips breakfast often. Then if she has breakfast, it's carbohydrates and coffee. Then she has some more coffee and some more carbohydrates. She has stir-fried chicken, which might have some vegetable in it. That would be good. Then she has vegetables at dinner. That's good. And chicken, and then pasta. And then she has a high glycemic snack at bedtime. So there's room for improvement there. Her exercise habit, kind of sporadic, no resistance training. She doesn't smoke or drink. She's on her levothyroxine, her Surzone, and her Nortate cream for her rosacea. She takes a multivitamin and calcium. She's actually taking a calcium magnesium supplement. Much better. Her BMI is 24.6. Not that bad in the United States. Her blood pressure is good. Her skin is slightly dry, and the rest of her exam is unremarkable. If your exam is unremarkable and your labs are unremarkable And your biopsy is unremarkable, and your colonoscopy is unremarkable. In a conventional doctor's office, you're a malingerer. You're taking up my time. Get out of my exam room. In a functional medicine doctor's office, you're a potential wealth of problems to prevent. So, here's her timeline. And notice that she started having her cyclic acne back in college. Then, so we know that her digestive system wasn't working very well even back when she was 20. Then she developed depression, probably from some nutritional deficiencies. And then she went on this psychiatric medication extravaganza to find the right chemical to plug into her brain to make happiness occur. And now she's hypothyroid. So her problems are depression. She's perimenopausal. She has hypothyroidism, maybe functional hypothyroid, meaning it's really her adrenals that are the problem, not her thyroid. She has fatigue, she has low libido, she has acne, rosacea. Okay? So, here's her story. Here's where we're going to go to solve her problems. And here's her matrix. So, where are the problems? Well, there's a lot of problem here, and there's a lot of problem here. And there's some problem over here. So, we're going to be looking in communication, that's hormones, and assimilation, that's gastrointestinal function. Those are the two places that we're going to address first. So what patterns did you recognize? Did you pick up on that acne rosacea pointing to the gastrointestinal tract? Did you notice that? So she's got an adrenal imbalance because she's exhausted and she's depressed. High cortisol causes depression. If you go through high cortisol to low cortisol, you'll often stay depressed. And her adrenal issues could have impacted her sex steroid hormones, which is exacerbating her perimenopausal symptoms. She probably has some nutritional deficiencies. And the ones we're going to want to look at the most closely are her methylation, because there's family history, right? And I would look at her omega-3 fatty acids because of her history of postpartum depression. Now she has low hydrochloric acid, and we're going to need to look at her gastrointestinal problems and potential food sensitivities. And I would add to this, a patient who's having this much trouble with brain function needs to have their amino acid levels looked at. If they don't have the precursors to their brain chemicals, you're never going to get their brain to work right. Same thing with omega-3 fatty acids. The brain is mostly fat. And if it doesn't have the right fat, it's not going to work. So we're going to tell her her story back. And my story to her would be something like this. Well, Mrs. Smith, I think that you've suffered nutritional deficiencies probably from childhood. Either you don't eat enough of the nutrients you need, or you have a genetic need for a higher amount than you're getting from your current food. Pregnancies made that situation worse, leading to brain imbalances, which caused your first episode of depression. And the drugs you've been on may actually have been making things worse. And I wonder if you'd be interested in getting off of those drugs. And most patients in my practice are very interested in getting off the drugs. So these are a couple of books that I recommend. Robert Whitaker has written a really interesting book on anatomy of an epidemic of drugs, psychiatric drugs in America. And Peter Breggin has written a series of books talking about what these drugs do to the brain, and this book tells you, this is a guide for researchers, therapists, patients, and their families on how to get off the drugs. It's not easy to get off these drugs once you've changed your brain anatomy. Okay, so what do we do about it? Well, what are her primary goals? She wants better sleep, she wants more energy, she wants to not be depressed, she has concerns about menopause. What I'm going to tell her about menopause is if we get her adrenals fixed and her sleep fixed and her depression fixed, she may just sail through menopause with no problems at all. Menopause may not be a problem until it becomes a problem because other things are out of balance. I mean, for some women, menopause is just, well, I stopped having periods. It wasn't a big deal. So my top priorities are her fatigue and depression and her nutritional deficiencies. So Dan initiated some lab work, and he wanted to look at CBC, CMP, lipid profile, B12, homocysteine, her B vitamins, her red cell magnesium, her thyroid studies, and he did an adrenal stress profile. Most of those lab tests were really normal. She had a slightly depressed red blood cell count, so maybe decreased iron, and iron is very important to some of these enzymes that run brain chemistry. Her B12 was low. If your B12 in serum is low, you're low. And here's her salivary cortisol level, and for those of you who need a visual, here's what her adrenal stress profile looks like. She gets up in the morning with a low cortisol. What does that mean? She's going to be dragging. She's going to have trouble getting up in the morning. She needs to have a cortisol level up here in the morning. And then the rest of the day, she kind of drifts through the day in the normal range, but by the end of the day, she's scraping the bottom of the barrel. Do you have that phrase, scrape the bottom of the barrel, like there's nothing left? So here's what stress is doing for her. It's taking all of her hormones, including the progesterone that she needs for balance when she's perimenopausal, and it's dragging it all down to cortisol. Everything is going to cortisol. In fact, it's been doing that so long that now her cortisol levels are too low. She has spent her adrenal reserves. So, what did Dan do with her? He demanded that she eat breakfast with a protein source. He said, you cannot skip breakfast when your cortisol is that low in the morning. You've got to get things up and moving. He asked her to decrease simple sugars and caffeine stimulants because both of those are stimulants. Those are both things that can raise adrenaline. She needs to stop driving her adrenals into the dirt. He gave her a couple of supplements. Now, he gave her adaptogenic herbs, Panax, rhodiola, and cordyceps, and a standardized licorice and ashwagandha. And Dan is a naturopathic physician, and he understands these herbs very well. And Patrick and I are MDs, and we don't get trained in herbal medicine. And I, like Patrick, tend to try to avoid these adaptogenic herbs. Part of the reason that I avoid them is that when I looked up those herbs, I found that their side effect profile was often, if you took too much, you had stimulatory side effects. And so it seemed to me that a lot of these herbs actually stimulate an adrenal that's already exhausted. So I don't want to just squeeze that adrenal and get a little bit more cortisol out of it. I want to fix it. So I don't want to stimulate her adrenals, even if it means she feels still kind of dragged out for a while. So I'm very careful. I might have given her a very low dose of DHEA, and Patrick told you 5 to 25 milligrams. I start with 1 milligram, and I titrate slowly until they feel better. And you know what the level that most women feel better on DHEA is? 3 to 5 milligrams. If you go too far beyond that, they don't feel better. I wouldn't use licorice on this patient unless it was absolutely necessary. Sorry, I'm doing something wrong here. Unless it was absolutely necessary, because as Patrick said, you're not fixing the problem. And if you make her feel better before you fix the problem, what's the chance that she'll fix it? Not so good. Okay. I would give her hydrochloric acid. I usually do what Patrick said, a hydrochloric acid pill test, and if they tolerate it, they take hydrochloric acid with meals. He gave her some other supplements to improve gastrointestinal function and increase her protein digestion so that she got those amino acids. She had a combination of B12 and intrinsic factor at 1 tablet twice a day for her borderline anemia, and he put her on EPA, DHA, the omega-3 fatty acids. What would I do differently? Absolutely yes to fixing her GI tract. Absolutely yes to methylation support. Oops, sorry. Absolutely yes to omega-3 fatty acids. And I would consider testing and treatment of her amino acid deficiencies at least until her GI function is better. So how did she do? Well, at 3 weeks, she was better. She felt better. She had discontinued her antidepressant prescription, not necessarily a good thing for her to do on her own. And she reported she was sometimes waking up in the middle of the night. So she was instructed to continue the program and add magnesium, calcium, and some sleep aids to improve her sleep. At 8 weeks, she's feeling good. It's the first time in 13 years that she has not been on an antidepressant or a brain-altering drug. She's having less gas and fewer food cravings, so her gastrointestinal tract is working better. She's absorbing her food better. She's having some hot flashes and waking up once a night, but she's able to get back to sleep and it doesn't bother her that much. She rates her overall improvement at 40%. Not bad for 8 weeks. I mean, how long did it take her to get into that hole? You know, to get 40% out of the hole in just 8 weeks, that's pretty good. Further evaluation of her diet, she was still eating a lot of sugar, and he gave her a high glycemic index or a low glycemic index diet. So she was counseled to get rid of the sugar, instructed on maintaining the program of magnesium and calcium, her herbal supplements, and he's beginning to change those to decrease the herbal supplements. At 12 weeks, she's improved her diet, she's improved her mood, her perimenopausal symptoms are better. Her acne is about the same with the hydrochloric acid supplement, but her gas is better, and she rates her improvement as 90% overall. Now, you will have some patients who are not going to be happy until they have 100% improvement, but most people at 90% are going to say, I'm good, thank you very much. At 12 weeks, here's her adrenal stress profile. Now, this is not a terribly expensive test. It's easy to do. You can do it at home. The patient doesn't have to come in and get blood drawn. And for those of you who need a, whoops, visual, where's my visual? Uh-oh, somebody took my visual away. This is improved. Her morning cortisol is increased. Her noon and 4 p.m. are about the same, and her midnight is no longer in the basement. So once again, Dan is moving her through this with very small changes, not pushing her, not doing everything possible, not giving high doses, not putting her on cortisol. Just small changes that allow her to have the adjustments that her body can make to bring her back into balance. Okay, and this is her 17-week cortisol profile. It's also a little better. Oops, and there it is. So now she's really in the normal range throughout the day. And at 20 weeks, she is taking less magnesium, the valerian supplement in the evening. She's sleeping well through the night. Her energy is good, and she's doing well overall. And she was instructed to discontinue her adaptogen herbs, and that's probably a good idea. And he put her on some vitamin support for building adrenal function, and I would have probably started there. But he may have used those adrenal supplements to capture, to get her interested in moving through this process, because they will make you feel better initially. And then it's important to get patients off of them. Okay. So at 24 weeks, she continues to get better. So what we want to do with our patients is we want to use evidence-based medicine, our clinical expertise, and include the patient preference so that we can create health in our patients with their help. And that's how we would use a functional medicine approach to 2 rather common and sometimes difficult problems to treat. Thank you very much.